Hello, my name is Adam Rosen. I'm an orthopedic surgeon who specializes in hip and knee replacement. I created another short video just to go over some of the basics of what actually is a hip replacement. So, in the normal hip, you have a ball, the femoral head, which is attached to the neck and attached to the leg bone, what's called the femur. And that hip normally sits inside a socket. And when you walk and bend and straighten, the ball moves inside the socket. But over time you can lose cartilage on both the ball and the socket side. And when that happens, people develop hip arthritis, and it hurts and it's painful. So when they failed conservative care options, we have a procedure called a hip replacement that would get rid of that arthritis and give you a new artificial hip socket. So what does that entail? What we do at the time of surgery is make a cut right along the top of my finger, which removes the ball and a portion of the neck. So that gets removed. It gets rid of the bad arthritis. The next point, you're looking inside the cup or inside the ball socket, which is called the acetabulum, and that's inside the pelvis. And when we're in there, we remove the bone spurs around the rim and have a device that allows us to smooth out the inside of the socket. And what typically gets done is two parts get placed in there once the socket is prepared. There's a metal shell, and the metal shell gets placed inside the socket. And what typically will happen over time is that the bone will grow onto or inside the pores of the metal socket. Occasionally, that socket will be also fixed with some screws. Once the metal shell goes in there, there's a liner that gets placed, which can either be ceramic or metal or plastic. More commonly, it's a plastic insert. And that gets snapped inside the metal shell. This will function essentially as your new cartilage or your new bearing. The way I describe this to patients is if you split a tennis ball and a racquetball in half, and you put the half of the blue racquetball inside half of the yellow tennis ball, that's essentially how the two of these are sandwiched together. If the plastic does wear out, that is something that could be replaced or revised at a later date by going in and removing it and placing a new liner. But once the metal shell goes inside the socket of the pelvis, there is a stem or a post which goes inside the thigh bone. And that essentially gets placed inside this tube, but lined up in that position. And there are all different style stems depending on the patient's anatomy and bone quality. Once the stem gets seated, what you typically will only see sticking out is the top, what we call the neck, and this top part called the trunnion. And that's what the ball gets attached to. This is a ceramic ball. They also come in metal. And again, depends on you and other factors, but once the ball gets seated or impacted on, that locks it in place. And this way, when you now stand up, this becomes your new artificial hip. And what you can see is as you walk and bend, it's the ceramic ball that will sit inside the plastic liner, which is inside the metal shell. And this is what makes up a typical hip replacement. I hope you found this information helpful. If you feel that you're a candidate for hip replacement, please make an appointment to see your orthopedic specialist. Thank you for listening.